As we discussed before, blood pressure readings can be taken manually using a sphygmomanometer and stethoscope. However, this is not practical during dental treatment, and so the electronic monitors are used to maintain consistency. Here we see a typical electronic blood pressure monitor in action. This particular monitor from Getronic shows the patient's systolic and diastolic pressures as well as their pulse in beats per minute. First, you will have checked prior to seeing the patient that the monitor has good battery charge and that the cuff and lead are attached properly. You then have the patient sit upright in a chair with their hand resting on the table. You will get the patient to roll up their sleeve so that the cuff will fit between their sleeve and antecubital fossa, or you will roll up the sleeve with their permission. You will see here that the practitioner pre-positioned the cuff with the lead on top and facing downwards. With the sleeve rolled up, you then slide the cuff onto the patient's arm and ensure the lead is in line with the middle of the ACF at the position of the brachial artery. Most cuffs, including this one, have a little arrow pointed to where the artery should be. You should then do up the Velcro on the cuff to secure it, and with the patient's hand or arm resting completely still on the desk and the cuff secured, you can press the start button on the monitor to start recording. The cuff will inflate on the patient's arm, and as it inflates you will see the systolic blood pressure reading start to increase on the screen. Once it gets close to the patient's own reading, the numbers will start to drop until their blood pressure is recorded. The heart flashing on the monitor here shows that the patient's heart rate or pulse is being measured. The blood pressure reading in this case, as you can see, is 108/62 with a heart rate of 63. This patient would be suitable for IV sedation. If a patient is very nervous, or if you are not completely sure about the blood pressure reading's accuracy, then we would recommend to take the blood pressure 3 times and take an average of the 3 as the starting blood pressure reading. If the lead is not on top of the cuff, i.e. the lead is trapped between the cuff and the patient's arm, then the cuff is on the inside out and needs turning around and replacing. Thanks for watching and good luck with taking blood pressure readings for your patients.